Oh, this is my song. I gotta go.
Before we hit up the party, let's go back in time. Today, HBC is heading to South Central Los Angeles, you guys. Did you know that South Central Los Angeles was historically known as a Black cultural hub? In fact, it was at one point known as West Coast Harlem because of its influence of the Jazz District. It was not until the 1950s that Los Angeles Black population was approaching 200,000. At the same time, South Central to Watts Corridor had become predominantly Black. With the spread of gentrification, the area is now formally known as South Los Angeles. Okay, y'all, I'm about to head out to another fair. I'm excited about the fair, but your girl is tired. Had an amazing workout last night. Woke up this morning and have a pull in my lower back. So let's see how this goes. I could have used some extra hands this morning, but you know, we got to do what we got to do. Show must go on. Okay, y'all, good morning. I'm sure you hear the music in the background. I am excited about the fair this morning. Always excited to be in the community. Love to be a part of HBC. Always present in the community, offering information, offering support, helping people to be advocates for their own health. And it's just a really exciting event. So come along with me today. South Central is now predominantly Hispanic, with the Black and white population almost exactly the same at about 18 to 19%. However, the Black population, like the Black population in most historically impoverished communities, still have barriers to healthcare, and that's why we attend these events. So our goal is to head into these communities so that the information is readily available.
Hey you guys, I'm here at Regenerated Church and we are at their annual health fair, and I have the organizer right here with me, Deborah Armstrong. So we're gonna find out, Deborah, what made you think that this was a priority for the community? Why is this important to you?
Well, I think it's important for all communities for people to come out and be aware of what's going on in your body, mind, spirit, and soul. So this is a great event that we have. We have all types of exercises, all type of awareness information for you to find out. We have the great doctor here, OB/GYN, Dr. G. We have mental health available. We have the tri-state that will give you free exams to check your A1C, blood pressure. So I think it's important that we all find out what's going on with our body, because we all want to live long and we also want to be healthy.
I know that's right. And how long have you been doing this?
For 3 years. Woo! And hopefully each year we will do more and more.
That's amazing. That's amazing. And we are right here. What area?
We are in South Central, 10525 South Avalon, with our great pastor, Philip White.
Woohoo!
We often use aids to teach about women's bodies and other healthy lifestyle choices. Changes in the community requires collaboration. We started the day focusing on flexibility with some healthy and very simple stretching. Follow along with us.
More about the equities or inequities in health, and then take advantage of the activities and the events for doing what? Lifting up our mind, body, and soul. Are you ready? Thank you, Pastor. Thank you, Sister White, for let's getting this together, and Elu for warming us up with that wonderful, wonderful yoga and stretch exercise. So now we're ready to go. Y'all ready to go? Let's go.
Hey you guys, so I'm here at the health fair and we are going to talk today about My Healthy Plate. We're going to talk about how we should be eating, what percentage of our food should be the different food groups, and we're going to talk about examples of these food groups. But you guys, one of the things that I realized today at their game, hello, Healthy Plate, I have a question.
We get ready to start
this
our
is listed
morning
as
workout with our
what
fitness
food
instructor.
group. So what food group would you guys list
if
this
you
as,
want to,
right?
just come on
So
up
most
here
people
like we
would
did
list
this
this
before.
as, see how it's green? It says
We're about to
veggies,
start our
but you
morning
know what?
workout.
This is technically a
I got you
fruit,
dressed
you
up,
guys.
so I can get
So
you
I have
sweating
a few
out.
questions with
So
the
you
My
got your
Healthy
hair all
Plate.
nice and
You guys have some things that
flat
are
and
listed as
straight
vegetables
and
that are
looking
really
pretty,
actually fruit.
curled up.
So let's talk about it.
Right to left.
One of the key things for these events is to provide activities for children. It's one of the ways to facilitate the ease of parents being able to come out and join these community events where they're able to explore information about their own health and not have to worry about what are the kids going to do.
So pretty. If I lose blood, I lose what nutrients primarily. If I lose blood, yes, which is what nutrients. Remember? It is gonna come. We're gonna come back to that because I know you know it. Okay. A pregnant woman who is low risk, a pregnant woman who is low risk, should exercise more, less, or the same as a non-pregnant woman. The same. Oh, you had one child? Yeah, it's the same. Okay. Name one complication related to diabetes or pregnancy. Sugar is high, you gain weight. Excessive weight gain. I told you. So you guys, we have Jessica here from Parkinson's Core Collaborative. She's going to tell us a little bit more about the organization and how you can reach out to them.
Yes, okay, so we are Parkinson's Core Collaborative. We are an academic community alliance. We really like to work with the community to address disparities of Parkinson's disease in the Black community. The Black community is underdiagnosed when it comes to Parkinson's, and we're trying to change that. We're trying to close that gap, and we're doing it by being here in the community, right? Away from the little Westwood bubble, into the community, and just spreading awareness. There's so many factors when it comes to the disparities in Parkinson's, but one piece that we're doing today is raising awareness and education and being able to spot that in our loved ones and ourselves and get treatment, right? There's so many treatments that are available for Parkinson's, and people are not aware of that. So
tell us more about that, because I do think a lot of people think that Parkinson's is sort of like a terminal condition, and that there's no hope, but it sounds like there's a lot of hope when it comes to treatment.
There is so many treatments when it comes to it, and the treatments will help with quality of life, help extend independence, which is one thing that I know that people struggle with, right, when we're talking about a degenerative disease.
Yes.
And so if we're able to get you on the right treatments, you can live a long and healthy and productive life.
That's great to know.
One big thing that people don't know is exercise is so great for Parkinson's, of managing the symptoms. And so, yeah, if you want to know more about us, we're on Instagram, we're on Facebook, and on Twitter.
What's your handle?
Yeah, at Parkinson's _core.
Awesome. Love it. That's a lot of great information. I know our community needs to know about Parkinson's.
Yes.
Thank you, Jessica.
Now it's time to get into some cardio for the day.
Put it back. Toss it back. Toss it back. Hey, I see you.
If you haven't moved for the day, this is a wonderful time to join along.
Step back, forward, count, let's go. 1, 2, 3. Touch, forward. Touch, 1, 2, 3. Front.
Hey you guys, exercise does not have to be boring. You can absolutely get your fun on doing some cardio, and don't forget your muscle strengthening. Don't lose that muscle mass.
Tell me, what's your style? Hey. Uh-oh. 5, 6, 5. Uh-oh. Here she goes.
In Health Street.
guys, as we've learned in recent years, racism is the strongest determinant to our health outcomes in the Black community. So participating in activities that release the effects of chronic stress on the body, including massage therapy, is so important to our health outcomes.
So you guys, we're so excited to have Judy here from Abounding Body and Health. Woo! Had us on the dance floor. Working out. So Judy, tell us about your organization.
So Abounding Body and Health is all about what it says. It's the body, mind, and soul. And what it does, it aims to increase the health for our communities, Black and brown people, and really reduce the inequities that we see showing up. And we do it not only through physical exercise, but we do it through mind support and having a mindset that says, we can do this, and reducing stigmas and looking really fully into what health will do for our community to extend its life and to create a wealth of life-sustaining function within our community.
Awesome! So the answer for that one is the first day of her bleeding. It's the date of her last menstrual period. The first day of her bleeding. I have another one for you. Avocado is a healthy fruit. True or false? Is avocado a healthy fruit? You got that right. Yes. And what a lot of people don't realize is that it's actually a fruit. Some people say it's a vegetable, but it's actually a fruit. Yes. You go. A lack of sleep has been linked with what diseases? Name at least one. A disease. A lack of sleep has been linked with what? Think of all the major diseases that people have. Cancer. Yeah, you got one. Cancer. That's correct. Yeah. That's what this is about. Exactly.
Right foot, let's stop. Left foot, let's stop.
Line dancing has had an incredible impact on our community, not only bringing us together as community, but also increasing our level of activity.
How low can you go? Can you go down low?
All right. So we're going to do another rapid fire question. I'm going to mix it up so we get some new questions.
Okay.
And excited. Okay, let's start with this one. A colonoscopy is recommended by what age?
I want to say 50.
It used to be 50, but they changed it. You know what the new age is? You would have been right just a couple years ago. It's now 45. And you know what? It's always been 45 for Black people. Yeah, so that's not new for us. Okay, which virus causes cervical cancer? HPV virus causes cervical cancer. True or false? A yeast infection is a sexually transmitted infection. Come on.
Sit and straight. Sit and straight. Sit and straight and sit right here.
And just a friendly reminder, you do not have to go purchase weights to build muscle mass. You can use your own body and very strategic movements, and you can build muscle strength just like this. We hope you enjoyed this recap and increased your awareness of the importance of community health events.
Hey you guys, thank you for joining us. This is Dr. T, the hand behind the handle Healthy Bump Club, right here on YouTube and HealthyBump.club on Instagram. Thank you for joining us today at the Health Fair at Regenerated Church. We hope to see you guys next episode. I gotta go dance. Bye y'all.